Go.
Hi, my name is Ann Thomas. I'm the patient you're going to be learning about in this case scenario. I wanted you to meet me and hear my difficult story because I can't be there in person. Several weeks ago, I had a mild stroke and went to stay with my family right after the hospital because I did not want to go to a rehab facility. I wanted to go home. The therapists were coming to the house. Excuse me. The therapists were coming to my house to see me, but I accidentally got COVID from one of my family members despite staying in my room. I started feeling achy and tired. Once I started having trouble breathing, a little bit right now, I knew I had to come back to the hospital. I've had a terrible time. When I first got admitted, it was scary. Not only because I couldn't breathe, but everyone around me had their faces covered in masks and were probing and poking at me. I don't remember much of what happened in the beginning, but what I've been told, I was very sick. The doctors had to put me on high flow oxygen masks, and that made me even more scared. Fortunately, because I couldn't breathe without the oxygen mask, and the nurses and doctors knew I was exposed to COVID, I was eligible for immediate viral treatment. Thankfully, I only stayed a couple of days in the COVID intensive care unit. On the other hand, my right-sided weakness from the stroke got worse. And my swallowing, if you noticed, I keep coughing because my saliva keeps going down, so I have to clear my throat. It hasn't improved. The doctors are saying I may have what they call long-term COVID symptoms, but I don't know what that really means. Huh. I'm guessing also that my high blood pressure, diabetes, and being overweight didn't help my condition too much either. The worst part for me, however, was being away from my family. I can't, even though the nurses and the doctors were great, I still felt alone. Right now, I'm feeling pretty weak and a little bit shaky, if you haven't noticed. The whole experience has left me anxious, nervous, and I just don't know what to do sometimes. I start to panic at little things like a cough or pain. When I have a cough, I don't know what's causing it. So I automatically go to COVID coming back. Even when the nurse or the doctor comes near me, I really feel nervous and I'm not sure exactly why. On top of all this, I'm the one who usually takes care of everyone else. I'm not used to being sick. And I'm so very worried about my husband. He lost his business a few months ago. He keeps saying everything's okay, but I know better. I know he's worried and barely sleeping. He's been feeling so helpless and frustrated because he can't be at the hospital or at the rehab facility with me, while my daughter has been struggling to keep us all afloat in the meantime. I'm really confused as to what to expect. For example, should I get the vaccine, the COVID vaccine, even though I had COVID antibodies now? I'm not sure what to do. What about my family? They didn't get the vaccine yet, and most of them didn't get COVID. My granddaughter, who gave it to me, didn't even know she had it. I'm feeling so overwhelmed. I really need to understand what support I can get to feel better and deal with everything I have going on at home.